Hi, I'm Chris Gilligan. I'm the Chief Medical and Quality Officer at Robert Wood Johnson University Hospital, and we're very excited for the Rutgers Health Hack. We focus on a lot of different important issues that affect patients. Many of them are, of course, as you might imagine, quality related, and some of those are things like infections related to if a patient has a central line, essentially a more advanced version of an intravenous line. If a patient could get an infection from something like a Foley catheter placed. And we're constantly looking for ways to decrease those and to make it easier for our clinicians to make moves that would decrease those infections, to put information in front of them at the right time about interventions that we could take to reduce those kinds of infections. We also have many instances where we have what we'll often call bundles. So, for example, if somebody's on a ventilator, there's a bundle of activities that we'll do to make that safer for that patient. And we want to facilitate both increasing compliance with those bundles, identifying if a patient is not getting parts of a bundle that would be important for them to get, and really, again, helping to make it easier for the clinicians to achieve really perfect, safe, high quality care every single time. There are some relatively simple quality metrics that are actually extremely important to us. One of them is hand hygiene. And so making sure that every time somebody goes into a room and out of a room of a patient, they're washing their hands. That sounds incredibly simple, but we want that to happen 100% of the time for every single person who works in the building. So solutions that can help us with that can actually end up decreasing infections for patients and, in fact, even saving lives. Other issues that we have that affect patient safety and also affect our capacity to take care of patients is making sure that we're being efficient in the hospital. One of the things that we focus a lot on is length of stay. And so things that can help a patient to move through their care and, frankly, move through the hospital more quickly. That actually makes it safer for the patient and also means that we can then treat more patients. We're not in a position where the hospital is so full that we have to turn patients away. And then the same thing applies to throughput on things like imaging studies, lab studies, other diagnostic tests, trying to make it so that the communication around those happens as quickly and efficiently as possible and with as little friction as possible. And also to help prioritize. We have, as you can imagine, there's a hierarchy of what are the most important, most urgent studies, and then the gradation from there. So to make sure that we're doing studies in the right instance. And also, for example, if there's a study that's being considered on a patient while they're here inpatient in the hospital, if that could be more appropriately done when they're an outpatient after their discharge, to identify that and get that information to the right people. Now, one thing that underlies really all good clinical care is communication among the different types of physicians, the nurses, the technicians, et cetera, the entire healthcare team. And in fact, when we look at quality issues, very frequently the challenge, the thing that leads to bad outcomes is a breakdown in communication. So we're extremely interested in things that will make it more frictionless, more instantaneous, to allow people to communicate, but also to make it so that they're not overwhelmed with trivial messages or messages that are not meant for them. So we're extremely interested in things that will facilitate communication. And I should say in all of these applications of data science and technology to care, what we really want to do is make it so that the clinicians can most easily focus on their work of taking care of the patient. And so just to make it as effortless and transparent and seamless as possible, to have technology that makes their job easier and in a way that makes care better, safer, and higher quality for the patients. The final point I would make is that we're extremely interested in patient experience, making sure that the patients experience everything from communication from the doctors and nurses, the way we explain things, such that the patient can understand them, that we've answered all the questions, that we've been compassionate and shown respect, all through aspects of the hospital, like keeping the hospital quiet. And technology can play a huge role in many of those things. For example, you'll notice that hospitals often have overhead paging for emergencies, and we're interested in technology that can get the word out to all of the right people in an appropriately urgent fashion, but without noise, so that patients who need to sleep and rest, et cetera, aren't being disturbed by a noisy hospital. And another issue talking about noise is what we call alarm fatigue. So we want to constantly work to get alarms such that the important alarms are going off and people are being aware of urgent and important issues, but there aren't so many alarms going off that people are overwhelmed by that and get alarm fatigue and stop being able to pay attention to that. And then I would be remiss if I didn't mention that we keep our records in an electronic health record, and we're always looking for solutions to make it easier for our clinicians to write their notes and to make those notes high quality and comprehensive and complete, to capture all of the relevant diagnoses and capture them in the right way and in the right place in the electronic health record, but at the same time to do that in as effortless a way as possible. So with that, I'll just say we're extremely excited about the hackathon, and we thank you all so much for joining us.